Hello, Trail Seeker, and welcome to another exciting episode of the Learn True Health podcast. I'm excited for you to learn from today's guest. He was recently on the show sharing some mind-blowing information, and now he's back because I wanted to dive deeper and explore thyroid and iodine and how we can use iodine to detox certain chemicals in the body that are wreaking havoc. I'm really looking forward to you listening to this and deepening your knowledge of how you can support your body's ability to heal itself. Another way that I support my body's ability to heal myself, and I would love for you to also do the same, is by using Sunlighten sauna technology. I had a heavy metal issue for many years. I didn't know it. I finally figured out that the cause of a lot of my health issues came from my body not being able to get rid of all the heavy metals that I had accumulated. I was having liver problems. I was having an array of hormonal issues. And as I did the heavy metal detox, and this is actually during doing the show, since I started the show 5 years ago, I got a Sunlighten sauna and I used it regularly. Almost every day, about, I would say 5 times a week, I would sit in that sauna for about a half an hour, sometimes 45 minutes. I feel amazing after I get out of a sauna. The Sunlighten sauna, especially because it uses a different kind of technology than the other saunas out there. It uses full spectrum, so light, and I had a whole episode with a cardiologist on this. Light is a nutrient that our cells have receptors for, which just blows my mind. And when you are in artificial light, you're not receiving it. So we become deplete. We end up missing out on, the cells are lacking this key component. When we are in a Sunlighten sauna, we're getting full spectrum, essentially nutrition from the sunlight nutrition. We're getting the mid, near, and far infrared spectrum. So there's receptors on our cells that receive this information. What's great about the Sunlighten is it decreases inflammation, decreases pain, helps the body to lose weight. We burn about 500 calories every time you do a sauna therapy. The sweat that comes out of you contains toxins that now your liver doesn't have to process, your kidneys don't have to process. There's heavy metals in that sweat, so now you're removing, you're eliminating things, not only chemicals, but also heavy metals. And it opens up the blood flow in the body. It helps to balance and stabilize blood pressure. People have deeper sleep because they've decreased the stress levels in the body. The stress hormones go down. There's this cascade of events that happen when we use sauna therapy. I also did an interview with a man who regularly, once a year, and he has a degree in traditional Chinese medicine. Every year he does a 30-day fast, and he spent thousands of his own dollars doing lab tests to show that long-term fasting helps the body to eliminate forever chemicals and the chemicals from that are in our food, that's in our food supply now, that disrupt hormones. And what he noticed is when he did a fast and incorporated sauna therapy as well, he had way greater results than if he just did a fast alone. That's because sauna therapy allows the body to bypass the liver, bypass the kidneys when it comes to detoxing certain heavy metals and certain toxins. And just everything I explained earlier about all the other things that it can do. I've had several interviews about saunas. If you want to dive into it and learn more about sauna therapy, just go to learntruehealth.com and search sauna. Or you can go to learntruehealth.com and search Sunlighten. We have, I remember 5 guests off the top of my head that all told me they own a Sunlighten as well and absolutely love it. Now, Sunlighten has these big wooden saunas that you can fit into a corner of your room. Or if you're like me and now live in a smaller space, you can get what's called the solo system. And the solo system is something that you put on top of you, lie on, and you put on top of you, and then you have a nice good sweat, like a cocoon. And then you are able to pack it up and put it away when you are done. And the solar system is so compact that, because it telescopes into itself, that it fits in a closet or under the bed, which is so fantastic. What I also love about it is it's ultra low EMF, meaning you won't have negative reactions like a lot of cheap saunas out there. Unfortunately, if you go to just buy a cheap one, you're ultimately going to be exposed to high levels of electromagnetic radiation, which is damaging to the body, not good at all. And then another thing that I love about the solar system and all of Sunlighten products, but especially the solar system, is it is non-toxic. The products they use, the padding they use for you to lie down on, is a non-toxic, made of non-toxic bamboo memory foam, which I did not know you could make memory foam from bamboo, but isn't that neat? And so it's non-toxic, it's low EMF. This is what I love about Sunlighten, is they truly are thinking about how you can support your body's ability to heal itself and detoxify. I know of several cancer patients as well who use Sunlighten's sauna technology to support their body's ability to fight their own cancer and live to tell the tale. So many reasons why I recommend Sunlighten. And I know right now they're doing a special. They often do specials at least once a quarter for our listeners. So you can give them a call just to ask questions like, what size fits in my house, and what's the pricing like, and what's the payment plan like if you want to do a payment plan. Then be sure to mention my name, Ashley James, and the Learn True Health podcast when you do call Sunlighten, so that you get the special listener discount. They're always putting specials on, especially for our listeners. I sat down and had a talk with the founder of Sunlighten and interviewed her, and she gave us a great deal, like free shipping, which saves you about $500, as well as $100 off of accessories. My favorite accessory is the bamboo cushion, and it has a bamboo cover. The reason why you want to use things like bamboo or organic cotton when you are in a sauna, if you're not going to be naked, you want to use all natural fibers, because synthetic fibers will block the rays of the frequency of the light. So the mid, near, and far infrared will be interrupted, and you don't want that. Excellent. Thank you so much for being a listener. Thank you so much for sharing my podcast with those that you love and care about. If you're interested in learning more about detoxifying and using sauna therapy for healthy hormones, for healthy hormone function, for weight loss, for lowering blood pressure, for supporting the body's ability to fight cancer, and also supporting the body's immune system, decreasing inflammation, decreasing pain, all these topics are explored in the podcast, learntruehealth.com. Search sauna or search Sunlighten. I have at least 6 episodes where we talk about how great it is, and multiple doctors that help their patients detoxify and absolutely love Sunlighten. And I have loved it. It has really, really helped me tremendously and measurably to remove heavy metals from my body. Thank you so much for your listener. Continue to share this podcast with those you care about. And if you want to come and discuss what you learned today, or if you have more questions, join the Facebook group. Go to learntruehealth.com/group, or you can search Learn True Health in Facebook. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 464. I am so excited to have back on the show Dr. David Brownstein. Man, when we had you on the show, that was just a recent episode, 462. You shared with us how you've been successfully treating all of your patients who are infected with the SARS-CoV-2 virus, and how you treat it much like all the other upper respiratory infections you've treated for decades, with amazing success, just outstanding success, and how the FTC that came after you because you're sharing for free all this information on your website, and they don't want anything that could possibly be considered a treatment or a cure or a therapy that is effective to be publicly posted, which just blew my mind. So listeners got to go back and listen to episode 462, for that information. What's cool though is that you're able to publish a book that's still protected under your freedom of speech rights. And so we have had several listeners who've read your book since having you on the show in episode 462, and they've reported in the Learn to Health Facebook group that your book on basically supporting the body's ability, the structure and function of the body's ability to fight off viruses and respiratory infections with holistic medicine, how your book's amazing and they loved it. And so I definitely recommend listeners check out all of Dr. Brownstein's books. You can go to drbrownstein.com. He has so many books. That's why I'm really excited to have him back on the show today. Today, we're going to talk about something that's I think this is really interesting, because there's a lot of doctors that say we have too much iodine. There's doctors that say we have too little iodine. Some doctors say we don't need it. Don't worry about it. You're just going to get enough in your food, or just, eat fortified salt or whatever. Is it the right kind of iodine? Are we getting too much or too little? What parts of the body use it other than for just creating thyroid hormone? So this is very interesting. We're going to dive into this because you have some information about preventing cancer as well, which I'm really excited about. Welcome back to the show.
Thank you for having me on, Ashley.
Yeah, absolutely. Yeah, I hope to have you on again and again, because you have so many amazing topics, and you're such a fantastic doctor. It really not only blew my mind, but many of my listeners also shared with me how you helped your dad reverse his heart issues by looking at his nutritional levels and balancing his hormones. And that was so cool. And that was kind of like your wake up moment to introduction to, seeing how much we're missing in the allopathic world, and how much, how so many doctors, like the world would be a different place if every doctor had the education that you've earned through your clinical experience through the years. I really wish that more doctors would read your books and learn from you, and continue the curiosity of what we can do with nutrition to support the body's ability to fight off disease and maintain optimal health. Having said that, let's dive right in. So tell me, what happened along your journey as a doctor that made you interested in wanting to explore the topic of iodine? And is it, do we need more of it? Do we need less of it? What's going on? What's going on with iodine?
Well, my journey with iodine began when I started holistic medicine. And I think, I talked about that story of my father in that previous episode, right?
Yes. Yeah. And that was mind blowing.
So let me give the Cliff Notes version of that, because that'll sort of segue into iodine. My dad was had his first heart attack at age 40 and his second heart attack at 42. And he suffered from severe coronary artery disease after that. And he had continual angina for 20 years. And when I was a conventional doctor at that time, and, I thought he was dying, and I think he was dying. And he was on 12 medications to treat hypertension, diabetes, and heart disease. And he looked awful and was doing awful. And when I was given a book from a chiropractor who told me I should look at this. And it was really my first anything holistic given to me, or anything shown to me. And so I read, it's called Healing with Nutrition by Jonathan Wright, who's an allopathic physician. And I read that chapter on heart disease first, and drew a few blood tests on my father and treated him with 2 natural therapies, natural testosterone and natural thyroid hormone. And within 7 days of that, he made a dramatic improvement. His pale and pasty color went pink and healthy looking. His 20-year history of using nitroglycerin daily for angina, for anything he did, went away, never to return. His cholesterol in the 300s fell below 200 without changing any of his bad dietary habits, and he looked and acted much better. When I saw the changes in my father, I knew that's what I wanted to do in holistic medicine. So because I used 2 natural hormones in my father, natural thyroid hormone and natural testosterone, every single patient I've seen since then a new patient gets a whole hormonal workup. And as part of that hormonal workup is, checking thyroid hormones, ovarian hormones, testicular hormones, adrenal hormones, pituitary hormones, and trying to balance the hormonal system and see why the hormonal system's imbalanced if it is. And so after I started doing this and using bioidentical natural hormones, I was seeing great results. Practice was growing. I was happy. I thought I was doing good in medicine and helping people, which is, what I was tasked to do in life. And, but it was bothering me. Why was I having to use so much thyroid hormone? I had, the first 10 years or so of my holistic practice, I would say I had about 75% of my patients on thyroid hormone, little amounts, and they were feeling better and their physiology was better and their biochemistry looked better on blood testing. And most importantly, they felt better, they reported. But, it was bothering me. Why do so many people need to take thyroid hormone? Why is thyroid gland so screwed up? And I would look at, the ins and outs of the thyroid and what makes the thyroid work, well, what doesn't make it work well. And when you read about the thyroid, you read about iodine. Iodine is an essential element that the thyroid utilizes to make thyroid hormones. And without iodine, thyroid can't make thyroid hormone. But it's not just the thyroid. All the glands of the body need iodine. In fact, every cell in the body needs iodine. But if we're going to focus on the glands for right now, that includes the thyroid, ovaries, uterus, breast, prostate, and pancreas. And these glands all make hormones and prostaglandins and other things. And there's not a hormone in the body that can be produced without iodine. So the highest concentration of iodine in the body is in the thyroid gland. And the active and inactive thyroid hormones, T3 and T4, the 4 and 3 refer to how many iodine atoms are attached to the thyroglobulin molecule. So the thyroid gland knows that iodine is, it's made iodine so important that it can concentrate iodine against a gradient, meaning the highest concentration of iodine in the human body is in the thyroid gland. There's very low concentrations in the bloodstream, and the body has developed an intricate mechanism to take iodine from a low concentrated area like the blood and put it into a higher concentrated area, the thyroid. And it's an ATP dependent process, so it's an energy dependent process. So we use up energy to do that. And, the body doesn't like to use up energy. It likes to conserve energy. And the reason it utilizes energy is because it's so important. We can't live without thyroid hormone. So I would look at what makes the thyroid hormone go and, think about why this patient needed thyroid hormone, why all these patients need thyroid hormone. And I would try iodine.
So many people are on thyroid medication, and it's just amazing. It blows my mind that they'll be on it for years and years, and there's no question, okay, well, what's the root cause or what's behind it, or why is the body not, especially women, and a lot of men, don't go for the tests, or the doctors don't test men, but men too. Why are they depleted? Why are they having thyroid disruption? And why is there so much Hashimoto's right now? Just like, it's way more than we had 30, 40 years ago.
Oh, it's an epidemic rates right now. And Hashimoto's is an epidemic rates. All those conditions in my, I write about that are, and I write in my book and in my newsletters and stuff. I say it's on all related to iodine deficiency. And the iodine deficiency causes problems with the thyroid, causes problems with the breast, prostate, pancreas, ovaries, uterus. And, what are we seeing problems of all those tissues? As you mentioned, there's epidemic rates of thyroid problems, from thyroid cancer to autoimmune thyroid disease like Hashimoto's and Graves' disease, as well as hypothyroidism. The fastest growing cancer in America right now is thyroid cancer. Fastest meaning the most diagnosed cancer. And then we have 1 in 7 women with breast cancer. We have 1 in 3 men with prostate cancer. We have epidemic increases of pancreatic, ovarian, uterine, and it's cancers, and it's all related to, I think, the same thing. It's iodine deficiency is a big part of that. And you mentioned that so many people are on thyroid hormone. People are on thyroid hormone, and the other problem with people being on thyroid hormone is so many people are on thyroid hormone and they still feel lousy. They still feel tired. Mm-hmm. They still feel achy. And, what many of these people need is iodine. If you put someone on thyroid hormone who's lacking iodine, you make the iodine deficiency worse. It increases when you put someone on thyroid hormone, which increases the metabolic needs of the thyroid gland. It increases the body's need for iodine. So you make iodine deficiency worse if you put them on thyroid hormone and they're deficient in iodine. And there are studies. There's been 3 of them over the last 20 years that show the longer women take thyroid hormone, the greater the increase in risk of breast cancer goes up over time. So after 10 years, there are women who take thyroid hormone for 10 years have a 50% increased risk of breast cancer compared to women who don't take thyroid hormone.
Amazing.
How can that be? I struggled with that when these articles came out. I didn't have a great answer, and I think the answer is they're iodine deficient. And as I wrote in my book, that you put a woman on thyroid hormone who's iodine deficient, you're going to make the iodine deficiency worse, and you're going to make it worse in other tissues besides the thyroid, like the breast, the ovaries, uterus, and that's why you're seeing, these cancers go up with that.
So are there receptors for iodine in other places of the body other than the thyroid hormone?
Every single cell in the body needs and requires iodine. The white blood cells need iodine to fight infections. Iodine is needed in fat cells and muscle cells and, immune system cells. Everything needs iodine. The problem is iodine levels have fallen over 50% across the United States over the last 40 years. And and you couple that with these, iodine is part of the halide family in the periodic table of elements. And the halides consists of fluoride, bromide, iodine, and chloride.
This was my next question. I'm so glad you're segueing into this. Please continue.
So of those halides, 2 are toxic and 2 are essential.
Yes.
So iodine and chloride are essential. We can't live without them. We need lots of it in our bodies. Bromide and fluoride are both toxic items that are non-essential, and we can live and we can thrive without them. We don't need them because they're both poison enzymes and they're not good for our body. The problem is, over the last 40 to 50 years, we've gotten way more fluoride and bromide from fluoridated water to brominated drink and bromine in flour, and it's a fire retardant used in so many consumer items such as phones and computers and mattresses and carpets and curtains and things, that we've become over-fluoridated, over-brominated, and at the same time, more iodine deficient. The halides are very interesting to study because they can competitively inhibit one another, which means that if you get too much of the toxic halides, fluoride and bromide, it'll kick the body out of the essential halides, chloride and particularly iodine. And if conversely, if you get enough iodine in and you're toxic on the other ones, you'll be able to release those. So, we've had a double whammy going on for the last 40 or 50 years. Iodine levels have fallen over 40 to 50%. At the same time, our exposure to toxic halides have increased. And that is the main reason I think we're seeing this rapid rise in thyroid disorders such as autoimmune thyroid disease, Hashimoto's and Graves' disease, hypothyroidism and thyroid cancer, as well as all the other iodine deficiency disorders, breast cancer, prostate cancer, pancreatic cancer, ovarian cancer, uterine cancer, and so on and so on.
So to put it in a way that we can kind of visualize, the thyroid, like you had mentioned, takes and concentrates iodine and tremendously. When we consume fluoride in tap water or bromide in baked goods, for example, that competes with iodine. Is the thyroid then concentrating the fluoride? Does it also then uptake and concentrate that as well?
Well, we know the thyroid can concentrate bromide, and we know if there's not enough iodine and excess of bromide, that the thyroid hormones can be brominated instead of iodinated. And we were designed by our maker to have iodinated thyroid hormones, not brominated thyroid hormones. So we don't quite know what the significance of that is because it hasn't been studied. But I can tell you, I think the significance of that is increased risk of thyroid cancer, Hashimoto's, Graves' disease, and hypothyroidism. And that's exactly what we're seeing. As far as fluoride goes, The conventional mantra is that fluoride helps prevent cavities. That has really been, if it does, it's a minimal improvement, but almost every Western country except two, us being one of them, have removed fluoride from the water supply because we realize that if it does increase or decrease cavities, it's minuscule. And the only way fluoride's been shown to decrease cavities is topically applying it, like in toothpaste, not by drinking water.
I do have a
And
question about that. For sodium fluoride, which isn't that a byproduct of aluminum production? And that's what we've been drinking basically in tap water. Um, I don't know if, I mean, I've read this, so I don't know if this is true or if this is just something that was, published online, but didn't they put sodium fluoride in certain prisons and certain concentration camps in the water in order to sedate the population, the prison population? Isn't fluoride in certain amounts kind of make a more lazy or less aggressive society? Is
the
that
Germans
true?
used it. The Germans used it in the concentration camps to do exactly that. And fluoride also has been shown to lower the IQ of newborns, mothers who drink fluoridated or have high fluoride levels. And there's been studies that show the IQ declines in newborns in women who drink fluoridated water at levels like what's fluoridated in the U.S. Um,
Huh. So we're creating a population that is less likely to rise up, rebel, and is also stupid. Um, that's quite fascinating, and this is why I really believe that we should question everything, and don't ever trust what's in your food, what's in your water, what's in your medicine. Always, always, always do your own research, and never trust anyone with your own health. Always filter your water. Don't just trust that your water is safe, or the air is safe to breathe, or the water is safe to eat, to drink, or the food is safe to eat. We have to be more diligent, because there's over 80,000 new man-made chemicals in the last 40 years that's in our food supply, that is we're now seeing are like forever chemicals, and that they enter our body and block our receptors from absorbing certain nutrients and from interacting with hormones. So it's quite scary. Fluoride uh, is an essential nutrient in small amounts in the soil. It's in the soil along with all other trace elements and minerals, and we're probably getting enough if we eat enough fruits and vegetables, and like you said, you could brush your teeth. uh, but then there's populations that don't have any fluoride whatsoever added, or added by added to their water, and that their teeth are wonderful. um, so when the body concentrates fluoride, do you think that also is a contributor to other hormone dysregulation and cancer creation?
well, studies have shown increased fluoride content results in certain bone cancers in young boys. We know fluoride poisons hundreds of different enzymes in the body. It's a known carcinogenic agent, and I think it's ludicrous to put fluoride in the water. If you can't afford an expensive filtration system, then you don't have a choice. You're just getting fluoridated water. I mean, what's you know
Mm-hmm.
where's personal choice come into play here? And it's you know remember the World Health Organization has done studies with cavity rates in fluoridated and non-fluoridated countries. There's no difference at all, and that's
Mm-hmm.
been shown over 40 to 50 years that the decline in cavity rates that have occurred over the last 50, 60 years have occurred in countries that don't fluoridate their water as well. And there's really no business in fluoridating water other than well, I don't know what it other than, but there's really no business in our health of doing that.
I can't remember the exact information, but I read an article years ago about they did this, and they did this in rural parts of Canada. I'm originally from Canada, but I live in the States now. And they gave tablets of fluoride to children because everyone was on well water. And one of my friends was part of this experiment. Governments like to do that thinking that it's healthy. It actually had the reverse effect, and all the children end up with rotten teeth. And there was something about too much fluoride or high concentrations of fluoride actually led to the opposite effect, that led to teeth that decayed rapidly. Maybe because it threw the body so out of balance. I don't know. I did see, when I was pregnant, I really looked into everything I could do to ensure my baby was healthy and that his or her IQ would be optimal. And I did see that iodine was one of the needed essential nutrients, along with essential fatty acids, that there were studies that showed that mothers that consumed iodine had smarter children. So that makes sense that fluoride, since it competes with iodine, would, dumb down the IQ. So it's like, that's the opposite, right? So what you're saying is we need more iodine. Now, you did mention that iodine helps to almost detox fluoride. So can you discuss that? How to use iodine as like a detox agent?
Well, like I said, with competitive inhibition, if you get one of the toxic halides that's a little too much, you're going to kick out iodine from the body. Conversely, if you get enough iodine, you can kick out those toxic halides and detoxify the body. Now, one of the problems is if you're full of bromide and fluoride when you take iodine, you can create what's called a Herxheimer reaction, where you get an overload of detoxification and people don't feel good.
Mm-hmm.
Now, if you're working with a holistic doctor who's knowledgeable about this, can help you avoid that. And, I don't find that happens very much in my office, but it can happen. So it just needs to be done appropriately. And, one of the ways to avoid that happen is when you take iodine, take salt with it. And salt's the second major constituent in the body next to water. And we need adequate amounts of salt. We need over 100 grams of sodium and chloride at any one time in our body. We're supposed to have that. Most people are deficient in salt. I've been checking people for 28 years on salt levels and recommending salt intake go up for many of my patients, because you need a lot of salt in the body. And salt can help usher out the bromide that's in there. And years past, there were medicines with bromide, such as bromoseltzer, that were used. And people would get bromide toxic. So one of the ways conventional medicine dealt with it, when they got bromide toxic, when they get delirious and, very tired, and, the brain wouldn't work very well, is they would salt the bromide out with an IV, a salt solution IV. But you can do that naturally with just taking more salt in your diet. I wrote a book about this called Salt Your Way to Health, which is, one companion book to the iodine book.
I love that you're bringing up salt. So many doctors say that salt is the contributor to high blood pressure, and that we should reduce salt or eliminate it completely, that we do actually consume more calories when something has salt in it. That's true. So we still have to manage our food intake, but know that when we add salt, think about a bowl of rice. If it's just a plain bowl of rice with no salt on it, you're going to eat to satiety. But with a bowl that is salted, we can overeat it because it tastes good. So we still have to be more conscious when we salt things that it does taste good, and we might eat past satiety. But what's interesting about salt is the body uses the chloride and sodium chloride to make hydrochloric acid. And there's a epidemic of heartburn out there, and indigestion. And of course, if you're not digesting your food, you're not absorbing your nutrition, and then everything cascades from there. And I'm sure you have a book on that. I'm sure you have a book on healing.
I talk about that in my salt book.
There you go. I knew it. I knew you'd have a book on that. But it's fascinating. So you recommend that people use salt along with iodine. Where should they get their salt? I know you're not going to say basic, table salt, or are you?
Well, there's two types of salt that are available: refined salt and unrefined salt. And refined salt is made by the food companies because they refine food products to take out things that degrade. And the reason they do that is the refined food product can stay on the shelf forever, and it has a longer shelf life. And then there's they make more money because they don't have to throw products out. So just as they refine flour to take out some natural things because the natural things will go bad, they refine salt. And the refined salt is that thin white stuff that's pretty much in every restaurant across the United States. It's, the girl with the umbrella on the side of the salt container. Can't think of the name of it. Is an example of refined salt. Yeah, it's just got sodium and chloride plus some other toxic ingredients that shouldn't be in salt, such as ferrocyanide and aluminum silicate in it.
Oy.
That's compared to unrefined salt, which has a full complement of minerals in it that come with wherever the salt is mined from. And Celtic brand sea salt and Redmond's real salt and Himalayan salt all have over 80 minerals in it. Now the minerals are in small amounts, but the minerals are essential and utilized. And I did a little study with my mentor in iodine. Actually, I didn't do it with him. I did it with my daughter Jessie when she was in middle school. She did it, and we did a study for her science class, where we looked at what the difference in pH of refined salt and unrefined salts. And refined salt creates an acidic pH environment. Really? Unrefined salt helps alkalinize tissues, and the minerals help to alkalinize it. And we can all, if you eat a bunch of refined foods, you're going to be too acidic, and that can lead to degenerative problems in the body. And you want to have a neutral pH, which is generally 7.2 or so. And refined salt can be part of maintaining that neutral pH, because we all tend to be acidic if we eat lousy food and we're stressed and we become nutrient deficient. So salt's really an important substance. That's why I wrote a whole book on that.
That is fascinating. That refined salt versus unrefined salt acts completely different in the body. One is acidic, one is more supportive and alkalizing. One has toxic ingredients as far as I'm concerned. I've even seen certain refined salts where one of the ingredients was sugar. I kid you not. I just laughed because so many people don't read labels. When I go to a grocery store, my husband gets so frustrated. He calls me the label reader. I will read all the labels. But when we go to a restaurant, you just trust that they're going to use good ingredients, and they don't. They'll use the cheapest ingredients. So we really have to be diligent to eat as much as we can at home and to use the healthy salt at home that has those trace minerals, that doesn't have all those weird agents in it that are very toxic for the body, if eaten over time. I always think about what our health was like 100 years ago versus now. The heart disease, cancer, these things are so much higher than 100 years ago. And we have to look at what we put in our mouth. What we put in our mouth every day is either hurting us or healing us. So we've got our salt. That's something that we can easily switch to. Because you've given us some good advice on how to find it. What about iodine? How should we take iodine? And we want to avoid that thyroid storm that might occur by consuming too high of a level of iodine. Because from my understanding, you consume too much, the thyroid kind of shuts down in a protective manner if you consume too much at once. So how to know how much iodine our body needs every day? Does that? I've heard some naturopaths like to use the skin test, where you put some iodine on the skin and watch how fast it absorbs. Whereas others say that's really not an accurate way to measure if you need iodine or not. So how do we figure out how much we need to take and in what form?
So the skin test is not an accurate way. There was a study that showed that 80% or so of the iodine placed on the skin sublimates into a gaseous phase and leaves the skin.
Oh.
So there's no reason to do that. That's not an accurate measure. And a large percentage of the body's iodine is in the skin. So I don't know if it's just you're measuring that. The best measure of iodine status is a urinary excretion test. And a holistic doctor can help you with that one. But it's, the iodine loading test is by far the best test. I was involved in developing that test and working with my mentor in iodine, Dr. Guy Abraham, who he developed the test. But we worked together on it and refining it, or I got to help refine it, um, but but urinary testing of iodine is the best way to go by far. The skin test doesn't show you much. What was the other part of your question, Ashley?
So, what form of iodine should we take, and how do we know how much we should be taking?
Well, you should get your levels checked and work with a doctor who's literate in iodine. And so that's number one. I don't suggest doing it alone, but um, I have 30 years of working with iodine. My first 10 years, I couldn't get it to work clinically in my practice because I was using the wrong form of iodine. I know now, what I did wrong, and I don't make that mistake anymore. But with iodine, I think the best form is using a combination of iodide and iodine. What that means is that's a reduced and oxidized form of iodine. For the chemistry people out there, if all the electrons in the outer shell are paired, that's a reduced element. And if there's one electron missing, that's an oxidized element. It's looking for an electron. So the reduced and oxidized form of iodine are used in different tissues of the body. The thyroid uses iodide, reduced form. The breast uses iodine, the oxidized form. So for a whole body effect for iodine, it's best to use a combination of the two. And so I use Lugol solution, which was first made in the 1800s. It's a solution of potassium iodide and iodine in water. And there's pills of this Lugol solution available too. And I find it very effective, and by far it's the best form of iodine out there.
Oh, fascinating. Now, of course, listeners can buy your book on iodine to get way more information. This was just a tip of the iceberg. How can we find a holistic doctor that is proficient in iodine? Can listeners work with you? Do you do telemedicine? Or is there like an organization they can look up? Where they can find a roster of doctors that are proficient with this?
Well, I don't have a roster of doctors. My book describes where you can do testing and all that stuff. The labs know who's sending in tests. So the best advice I can give people is call a lab who's doing an iodine loading test, and there's a few of them out there, and they'll tell you who's sending in tests in your area.
Oh.
And that's one way to look for who's doing the iodine testing out there. Unfortunately, there's still a lot of misinformation about iodine, even in the holistic world. People don't, I call it medical iodophobia. They're afraid to use iodine. It's been successfully used for over 4 generations of clinicians for their own unnatural fears, and not looking at the science and not looking at what's really true with iodine out there.
Could you share a story of success that you've had, or a few stories of success you've had with your patients? How has iodine changed their lives?
Well, I've had so many patients who, first 10 years, I have 3/4 of them on iodine, and then now I have less than a quarter of my patients on thyroid hormone because they're all on iodine. So when people, I diagnose them with a thyroid problem, I also do a hormonal nutritional workup at the same time. So if they're iodine deficient, what I always teach doctors when I teach them about iodine is to correct iodine deficiency first, or concurrently with thyroid hormone. Don't put them on thyroid hormone first, because you make the iodine deficiency problem worse, as I said earlier. I have a patient who had a bad fibrocystic breast disease, and her breast came to me with a bilateral mastectomy scheduled for 3 weeks after that visit. I was the last resort for her. Mm-hmm. She's a nurse. She's a nurse at the University of Michigan, and she was miserable. She couldn't wear a bra. She couldn't wear any, not even tight clothes, but just, what do you call it? Form-fitting clothes or something like that.
Mm-hmm.
She, couldn't stand anything tight on her. She was wearing this baggy stuff, which was still hurting her. And if anyone rubbed up against her breasts, if she bumped into anything, she'd start crying. She'd been to the University of Michigan Cystic Breast Clinic, and they had told her to come off caffeine and chocolate and clean up her diet. And she wasn't eating a bad diet, and she tried all that, and it helped a little bit. But then, symptoms got worse over time. And really, they told her the only thing you can do is have a mastectomy.
Oh.
So she's a lady in her late 30s, scheduling a bilateral mastectomy, and she had enough. So she came to me as a last resort, read my book on iodine, and read about fibrocystic breast disease. And I drew an iodine loading test on her. The iodine loading test is where you take 50 milligrams of iodine at time 0. You collect 24 hours of urine after that, and you measure how much iodine comes out in the urine over that 24 hours. And since when you take iodine orally, 98% or so is excreted in the urine, you can measure the amount in and the amount out, subtract the numbers, and know how much the body hung on to. And generally, when the body hangs on to more iodine, it's more deficient. So once people get iodine sufficient, they have enough iodine in their body, and they take 50 milligrams, they'll pee out about 95 milligrams, or I'm sorry, they'll pee out 45 milligrams for 90%, and they'll hang on 95%. They'll hang on to 5% of it or so, and that's iodine sufficiency. So in her case, this patient, she peed out 50% of the iodine and held on to 50%. So she was very deficient. So I told her to move her surgery back 3 months. I said, let's give this a try. Mm-hmm. I said, it won't be gone in 3 months, but it should be markedly better. And if it's not better, it's too late. I didn't know if it was too late. Tissues sometimes get so disorganized and, such a mess that you can't get them to come back, sometimes in the body. So she called me up after 2 weeks into it and said she's starting to feel better. And I saw her a month later. She had moved the surgery back 2 more months, and she said she's 50% better. And she, her breast, when I did an exam the first visit, her breast felt like, the best description I can give you is when I used to take Taekwondo in my younger days, like that punching bag feel, like a hard punching bag with bumps on it. It felt like alien tissue on her chest. And I could barely even touch it because she was wincing and, in pain. So I didn't do an exam at the 1 month visit, but I asked her to come back in another month. And she came back in another month and said she's 80% better. And I examined her breast at that point. It felt like she had new breasts, like she had a breast transplant. The punching bag feeling was gone. She still had lumps, but they were much smaller. Now I could do almost a full exam and, very minimal discomfort. She canceled her mastectomy surgery. I saw her back 3 month visit, almost normal breast tissue, no bumps. She went back to her fibrocystic breast clinic and had an exam. And the doctor said, wow, what are you doing? This, it's way better. And so she started to tell him, and she said he just glazed over his eyes. He didn't really listen. And then he said, all right, when she stopped talking, he said, all right, I'll see you in 6 months. And that's a good story. And another good story with iodine is a lady was I diagnosed her with inflammatory breast cancer, the worst kind of breast cancer. Mm-hmm. Usually you're dead in 3 to 6 months from diagnosis. And I was doing a study on iodine at that time with Dr. Abraham, and I put her in the study group of breast cancer diagnoses. And she had very low iodine testing, and I put her on iodine, 50 milligrams. And she called me up about 2 weeks into it and said, I'm having a problem with the iodine. I said, what's the problem? She goes, my nightshirt is yellow over where my breasts are when I wake up in the morning. And I'm on the phone with her, and I said, oh, well, how do you feel? She goes, I never felt better. I'm able to babysit my grandkids now. My energy's coming back. And she goes, I don't know what to do. And I said, well, why don't you come in, bring your nightshirt with you. So she brings a nightshirt. You can clearly see this yellow stain on the inside of her nightshirt. And I asked her if I could keep the nightshirt and analyze what the yellow stain was. And she had yellow nails. Now,
Wow.
there's not many things that cause yellow nails, except for maybe if you got jaundice. But it wasn't a jaundice yellow. It was a little different yellow.
And her eyes weren't yellow?
Her eyes were not yellow. She was not jaundice there. But her nails had this particular yellow color to it. It was, how would I describe it? Not a jaundice yellow, but just a different shade. It's hard to describe it. So I said to her, bromide has a yellow color to it. You're probably detoxing from bromide.
Oh my gosh.
And she said, what do I do? And I said, well, I'm gonna put my head together with a friend of mine and we're gonna analyze this t-shirt. And I said, since you're feeling good, up your salt intake to another teaspoon a day. I put in a teaspoon of salt with it, and increase your water intake and start bathing in Epsom salts, and we'll get this bromide out of you. And she kept on the 50 milligrams of iodine. She was part of a study, so I did when I tested her, we did a bromide check on day one. And when she took that 50 milligrams of iodine, her bromide levels were the highest I've ever seen. 30 days later, I check her iodine and bromide levels again. Her iodine now was coming up, and her bromide was starting to come down. 60 days later, she didn't have a lot of bromide, and her iodine levels were stabilizing at high levels. And she felt much better. She lived 6 more years. She died of inflammatory breast cancer and had a good 6 years. The only thing I would do differently with her now is I would have put her on more iodine from what I know now. I did have the shirt analyzed, but it's a funny story with that. I lost her shirt. We were moving our house, and I was consulting with Charles Hakala from Hakala Labs, and we were developing a chemistry experiment to take a slice of this, take a gram of the shirt from over her breast where it's yellow, and a gram of the shirt from the back where it's not yellow, and analyze the halides, fluoride, chloride, iodine, and bromide. Mm-hmm. And we knew how to do that. And so we were planning it out, and then I lose the shirt. I look all over the place. Can't find it. I look at work, I look at home, and I had moved my home. We were packing stuff up and moving. So we moved to our next home, and I can't find the iodine, it's done. So I had some shelves in my office that maybe 10 years later from this incident, it was just a couple years ago, I was cleaning out, and lo and behold, in the back of the shelf is that shirt in a bag. I had sealed the bag. It was sealed. I couldn't believe when I found it because I looked for it for years. And I opened the bag, and it's still got the yellow color to it. I call Charles. We pull up our data. We do the experiment on it. Her bromide levels were, I don't remember the numbers, but they were really high. And on the back of the shirt, there was no bromide. And so she was excreting bromide. And, this was the first case history ever reported of someone detoxifying from bromide in that way.
From her breasts?
From her breasts.
Where the cancer was.
And her nails.
Yeah. Wow. Well, thank you so much, Dr. Brownstein. I know you have to go. Thank you so much for coming here today and sharing this information. I think it's so vital that we continue to seek out information to add to our nutritional protocol, and also the idea that using certain things like iodine for detoxification as well is really critical. It's always a pleasure speaking with you. Listeners can go to drbrownstein.com. They can also go to centerforholisticmedicine.com, and please get Dr. Brownstein's books. Go to his website. Lots of great information. Of course, listen to episode 462. Where he shares his very fascinating story with very successful treatment of his patients over the last year plus that have had coronavirus infections. Thank you so much for coming on the show today. Is there anything you'd like to say to wrap up today's interview?
No, thanks for having me, Ashley. And I would say that if you're not feeling good out there and you're sick and you're not getting answers, really try and find a good holistic doctor who can help work with you. And work together with you to find out what's wrong and what's imbalanced. And the human body's pretty well designed when we give it what it needs, and we keep away from it what it shouldn't be exposed to. It takes a little bit of work, but the work can be worth it, because should go through life feeling good with enough energy and be happy.
Absolutely. That is my philosophy as well. Thank you so much, and I look forward to having you back on the show. Have a
Thanks,
great day.
Ashley.
Thank you. I hope you enjoyed today's interview with Dr. Brownstein. And I just wanted to remind you, if you're interested in using the Sunlighten technology to help your body detoxify and achieve your health goals, I highly recommend going to sunlighten.com, checking it out, listening to my interviews about sauna therapy and specifically using the Sunlighten technology, which you can find those by going to learntohealth.com and using the search function there. Or just give them a call. Just Google Sunlighten Sauna, and give them a call. Make sure you mention my name, Ashley James, in the Learn True Health podcast, so that you get this special that they are giving our listeners this month. I want to make sure that you get the best discount and also get the best experience with them. And if you have any questions about my experience with Sunlighten, feel free to reach out to me. You can email me, support@learntruehealth.com, and you can also reach out to me in the Facebook group by going to learntruehealth.com/group to be redirected to the group, or just search Learn True Health in Facebook. So again, that's Sunlighten Sauna, and Google them, give them a call. They're all wonderful to talk to. And then make sure you mention Learn True Health, the podcast, and Ashley James to get your special. I am just so thrilled with the outpouring of information, the sharing from all the listeners these last 5 years. So many listeners have gotten a Sunlighten sauna or done other practices that other guests have recommended, and then they come back and they share with me, they email me, or they share in the Facebook group. And so many people have been thrilled with their experience using the Sunlighten sauna, as have I. That's just one thing for me to say, that I've had a great experience. I've had an amazing experience, and my guests to share that they and their patients have amazing experiences. But then when we see it in the Facebook group, when listeners are sharing that they love their solar system or love their Sunlighten, and that it's made such a difference in their life, it's really cool that as a community we can come together in the Learn True Health Facebook group, and we can share what's worked for us so that we can learn from each other. I hope you have a fantastic rest of your day, and look forward to you coming and joining the group and sharing with us what you've loved about what you've learned and loved learning from the Learn True Health podcast. Have yourself a fantastic rest of your day.